Whispers from the Morgue, The Lost Ethics Files, Who Owns Your Cells After Death, The Hela Legacy, a deep dive. In 1951, when Henrietta Lacks sought treatment at Johns Hopkins Hospital, the concept of informed consent was virtually non-existent in research protocols. Henrietta Lacks, a 31-year-old mother of 5, sought treatment for cervical cancer at Johns Hopkins Hospital, one of the few hospitals that treated Black patients at the time. Without her knowledge or consent, a sample of her cancerous tissue was taken during a biopsy. Dr. George Gay, a cell biologist, received samples of her cervical cancer tissue and made a groundbreaking discovery. Unlike other human cells that died quickly in culture, Henrietta's cells doubled every 20-24 hours. The aggressive nature of her cancer created a cell line that was effectively immortal. These cells, later named Hela cells, were found to be unique in their ability to proliferate indefinitely in a laboratory setting, making them the first immortal human cell line. However, Henrietta Lacks and her family were never informed about the use of her cells, nor did they benefit financially or otherwise from their widespread use. The irony remains stark. While Henrietta died at age 31 from her aggressive cancer, her cells continue to live and multiply in laboratories worldwide nearly 75 years later. Hela cells revolutionized medical research and countless other scientific advancements. Scientists have grown an estimated 50 million metric tons of Hela cells, and these cells have been used in over 74,000 studies, contributing to numerous medical breakthroughs. Development of the polio vaccine, advancements in gene mapping, cancer and AIDS research, testing the effects of radiation and toxic substances, in vitro fertilization techniques. The ownership question. The question of who owns pathology samples forms the heart of this ethical dilemma. In forensic pathology, the use of human tissue and cells without consent has raised similar ethical concerns. For example, post-mortem examinations and the retention of tissues for research have often been conducted without the explicit consent of the deceased or their families. This practice has disproportionately affected marginalized communities who are often unaware of their rights or unable to advocate for themselves. The case of Hela cells highlights the historical lack of informed consent in medical research, particularly for marginalized groups. During the mid-20th century, ethical standards for patient consent were either non-existent or poorly enforced. Henrietta Lacks' story is emblematic of a broader pattern of exploitation, where the bodies of Black women and other marginalized groups were used for scientific advancement without their permission. When Henrietta's cells were taken in 1951, there were no legal frameworks addressing ownership of biological specimens. The prevailing mentality treated discarded tissue as medical waste, legally abandoned by the patient and available for research use. For decades, the legal precedent established in Moore versus Regents of the University of California in 1890 reinforced this view. John Moore's spleen cells were used to develop a valuable cell line, but the California Supreme Court ruled that patients do not retain rights to cells removed from their bodies. The court feared that recognizing such rights would hinder scientific progress. However, the landscape has evolved. Legal developments. The common rule, revised in 2018, now requires informed consent for research use of identifiable biospecimens. HIPAA privacy rule provides some protections for patient health information, though with research exemptions, GINA, Genetic Information Non-Discrimination Act, offers limited protection against genetic discrimination. Ethical frameworks. The concept of genomic justice has emerged, arguing that individuals have interests in their biological materials that extend beyond privacy. Cultural and commodity interests may be at stake, particularly for indigenous peoples and racial minorities. Profit-sharing mechanisms should be considered when commercial applications arise. The Lacks family journey. The Lacks family's story illustrates the personal impact of these abstract ethical questions. For decades after Henrietta's death, researchers published her name, medical records, and even her cell's genetic sequence without family notification. Her children were asked to provide blood samples for research without being told why. In 2013, the NIH finally reached an agreement with the Lacks family, giving them some control over access to the Hela genome data and acknowledgement in scientific papers. While this represented progress, it came 62 years after Henrietta's cells were first taken. The exploitation of Henrietta Lacks' cells is part of a larger history of unethical practices in women's health. For centuries, women's bodies have been subjected to medical experimentation without their consent. Examples include the Tuskegee syphilis study. While not exclusively focused on women, this infamous study involved the deliberate withholding of treatment from Black men and their families, including wives who contracted syphilis, to observe the disease's progression. This study exemplifies the systemic disregard for the health and autonomy of Black women. Forced sterilization. Throughout the 20th century, thousands of Black, Indigenous, and Latina women were sterilized without their consent under eugenics programs in the United States. These practices were often justified as a means of controlling undesirable populations. United States. In the 20th century, tens of thousands of Black, Indigenous, Latina, and poor white women were sterilized without their consent. Programs in states like North Carolina and California targeted women deemed unfit to reproduce, often under coercive conditions. Nazi Germany. During the Holocaust, Nazi doctors forcibly sterilized Jewish, Romani, and disabled women as part of their eugenics program. Peru. In the 1990s, President Alberto Fujimori's government implemented a program that forcibly sterilized over 200,000 indigenous and rural women, often without their knowledge or consent. India and China. Both countries have faced allegations of coercive sterilization campaigns as part of population control policies, disproportionately affecting poor and rural women. Gynecological experiments. J. Marion Sims, often referred to as the father of modern gynecology, conducted painful and unethical experiments on enslaved Black women without anesthesia, claiming they did not feel pain as intensely as white women. His work laid the foundation for gynecological medicine, but at the cost of immense suffering and exploitation. Lack of research on women's health. Historically, medical research has focused disproportionately on men, leading to gaps in understanding and treating conditions that primarily affect women, such as endometriosis, polycystic ovary syndrome, PCOS, and certain types of cancer. This bias has hindered the development of effective treatments and diagnostics for women. Thalidomide tragedy. In the 1950s and 1960s, the drug thalidomide was prescribed to pregnant women worldwide to treat morning sickness. It was later found to cause severe birth defects, including limb deformities and organ damage. Lack of testing. The drug was inadequately tested for its effects on pregnant women, highlighting the broader issue of excluding women from clinical trials and failing to consider their unique health needs. Exploitation in clinical trials. Women, particularly those from marginalized communities, have been exploited in clinical trials without proper consent or consideration of their health. HIV/AIDS trials in Africa. In the 1990s, pregnant women in sub-Saharan Africa were enrolled in clinical trials for HIV drugs without being fully informed of the risks. Some were given placebos instead of effective treatments, leading to preventable mother-to-child transmissions. Depo-Provera trials. In the 1970s, the contraceptive Depo-Provera was tested on women in developing countries without adequate informed consent or follow-up care. The legacy of Hela Cells and ongoing ethical challenges. Henrietta Lacks' story came to public attention in the 1970s, decades after her death, when her family learned about the widespread use of her cells. The Lacks family has since advocated for greater recognition of Henrietta's contribution to science and for ethical reforms in medical research. In recent years, there has been growing awareness of the need for informed consent and equitable treatment in medical research. However, challenges remain. For example, genetic privacy. The sequencing of the Hela genome in 2013 raised concerns about genetic privacy, as it could potentially reveal sensitive information about Henrietta Lacks' descendants. After protests from the Lacks family, researchers agreed to restrict access to the genomic data. Compensation and recognition. The Lacks family has never received financial compensation for the use of Henrietta's cells, despite the billions of dollars generated by Hela-related research. This raises questions about who benefits from scientific advancements and who is left behind. Systemic inequities. Women, particularly women of color, continue to face disparities in healthcare access and treatment. Unethical practices in research and medicine persist, often under the guise of scientific progress. Post-mortem specimens. The broader context, the Hela case sits within a larger pattern of post-mortem specimen collection that disproportionately affected marginalized communities. Anatomical collections in medical museums. The Mutter Museum and similar collections contain thousands of specimens, many obtained without consent. Bodies of the poor, institutionalized, and racial minorities were frequently used for dissection and specimen collection. Sarah Bartman's remains were displayed in European museums until 1974. Forensic collections, coroners' collections of brain tissue, organs, and other specimens for research and education. Anthropometric data collection from marginalized populations, DNA databases created from forensic samples, modern ethical frameworks. Today's ethical guidelines attempt to balance scientific progress with respect for human dignity. Consent models. Broad consent allows for future unspecified uses. Tiered consent permits specified categories of future research. Dynamic consent. Ongoing communication with donors about new uses. Community consent. Particularly important for indigenous communities and other groups with collective interest ownership models. Traditional property model. Tissue as abandoned material. Custodianship model, researchers as stewards rather than owners. Trust-based models, samples held in trust with defined obligations. Benefit-sharing approaches, ensuring communities gain from research. Forensic medicine's pioneering role. Forensic medicine now has an opportunity to pioneer more ethical approaches, trauma-informed practices, recognition that post-mortem examinations involve real people with grieving families, cultural sensitivity in handling remains, transparent communication with families, about specimen retention, community engagement, participatory research design involving affected communities, advisory boards with diverse representation, or returning research findings to communities, privacy protections, de-identification protocols for specimens, secure data storage and access controls, clear policies on secondary uses of specimens. The way forward, the ethical use of human tissues in forensic science and medical research requires recognition of historical wrongs without allowing them to paralyze progress, transparent consent processes that respect autonomy, equitable distribution of benefits from research, inclusion of diverse perspectives in ethical oversight, balance between individual rights and collective good. The stories of Henrietta Lacks, the Puerto Rican women, and countless others are not just historical footnotes. They are a call to action. Their sacrifices have paved the way for progress, but they also remind us of the ethical responsibilities we bear. As we honor their legacy, we must ensure that women's health is prioritized, their voices are heard, and their consent is never an afterthought. The morgue whispers not just of the past, but of the future. A future where ethics guide science, where women's health is no longer sidelined, and where the lessons of history shape a more just and equitable world. This is the legacy we must carry forward. The story of Hela Cells reminds us that behind every specimen is a human story. By acknowledging these stories and centering them in our ethical frameworks, forensic medicine can help ensure that scientific progress advances alongside, rather than at the expense of human dignity. If you found this exploration of Hela Cells and medical ethics valuable, continue the journey by subscribing to Dr. Moore's Diaries for more thought-provoking content on the intersection of science, ethics, and human stories.